Okay, everyone, I think I'm going to go ahead and get started. I'm going to kick us off tonight, and then I'm going to quickly hand things over to Janae Harvey, our Division Director over Family Wellbeing and Protection. But I'm Kelly Garcia. I'm the Director of the Iowa Department of Health and Human Services. Thanks so much for joining us tonight. We have a comprehensive set of team members here on our inaugural Foster Parent Town Hall. So this idea came about some time ago, really. I spend a lot of time meeting directly with foster parents. It is absolutely one of our goals to better support the incredible work that you all do. And so no better way than to do that work than to have a regular meeting where we are able to tell you the kinds of things we're working on to strengthen the system. And then we pause and take some reflections directly from you. So tonight, that is just exactly what we're going to do. Janae is going to kick us off to talk about the framework of tonight's discussion. And then we will quickly hand that over to a really wonderful partner we have in better supporting foster parents. So thank you so much for being here tonight. Janae?
Thank you, Director Garcia. Again, my name is Janae Harvey, and I'm the Division Director of Family Wellbeing and Protection. I will be leading us through the first few slides for the presentation tonight before I hand it off to our two co-presenters. We have a very robust agenda. Setting the tone for the agenda of the town hall, I wanted to let you all know that we worked with the foster parent advisory team in order to gather some of the agenda items we thought you may want covered tonight. But we really want to hear from you. So as we move forward, there is an opportunity up on our website that if you have an agenda item that you feel like we should be covering, we want to hear from you. So we'll give you more information on how you submit those ideas. But for tonight, these were our most informed choices for what may interest you. We are going to be covering our family first and our reunification philosophy, what it means to foster in Iowa. We're going to give you an update on the bridge meetings, some legislative changes, and lavender bunnies. So we're bearing the lead in terms of bunnies. If you want to know more about that, stay till the end. So let's go on through to the next slide. This is the organizational structure for the Family Wellbeing and Protection team. We have three very important areas of work that sit within our division. We have all things related to childcare that is headed up by Director Ryan Page. We are honored that Director Lori Frick is here and will be co-presenting on the presentation this evening. She is also our inaugural director over the Integrated Child Protective Services, which means all of the policy and practice reports up to her leadership. And finally, we have Director Shelley Horak, who is our director over early intervention and support, which is really bringing together our efforts to develop a system of primary prevention statewide that figures out ways to deploy family, home-based support, concrete goods, and economic supports as an effort to stabilize family dynamics and hopefully keep them out of the child protective services work that occurs in our state. So at this point, I believe I am handing this part of the presentation over to Tracy Schermerhorn. She and Director Frick will be leading the presentation throughout the rest of this evening. Take it away, Tracy.
Thanks, Janae. Like Janae said, my name is Tracy Schermerhorn, and I am the co-founder of the Foster Squad. We are a central Iowa-based nonprofit. I started it back in 2019 after my own journey in foster care, so I can relate to all of you on the phone who are foster parents. I walked in your shoes, and after we decided as a family not to continue, I didn't want to leave the system, and so we started the Foster Squad to help fill some gaps that we saw that were in the system when we were fostering ourselves. So some of the things that we do to try to support you guys through your journey. We have a support group that we offer in Central Iowa, and then we do trainings throughout the state. Those support groups and trainings have been a great way for us to become your voice. And we meet with Director Garcia and Janae and Lori on a quarterly basis, and we can share with them some of the concerns that you guys have. And so as we hear consistent things with issues that you have, we report back to them and then try to help them work through some ideas to make your lives a little bit easier. And that's been great. And there's been some really cool things we've done together in partnership with the state leadership to make some changes. And I think Lori's going to fill you in a little bit later, but we also tried to do some advocacy for you guys this year and getting some changes to the foster care stipend, but I'm going to let Lori give you the details on that a little bit later. We also provide a care kit. So if you are in Central Iowa and you have a new child come into your home, you should get a care kit from us. That's a new backpack or diaper bag filled with some essential items to help make them feel welcome in their new home. And we're working on rolling that out throughout the state and some other areas where those aren't currently available. And then the last thing to talk about tonight that we do is we have an initiative called Operation Santa. Last year, we had a Christmas party at the Blank Park Zoo with Santa, and families who had a child placed with them were able to submit a wish list, and somebody in the community bought a gift for that child. And so we did that in Polk County last year, and in a few other counties, we were able to provide gifts to over 500 kids throughout the state, working closely with Four Oaks to make sure we were reaching out to all the right families. And this year, we're going to do it statewide. So we're going to try to find a way to make sure every child who's placed out of home at Christmas this year gets a gift bought by somebody in the community. So that's who the Foster Squad is. I think it's Lori's turn now, right?
Okay, it is my turn. And I have been having so many issues with my computer today, so I switched over to my phone. So question first is, can you guys hear me okay? All right.
We can, Lori. Yep.
Awesome. Thank you. Tracy gave me a thumbs up also. So thank you, Director. I'm going to go ahead and just kind of talk a little bit about the vision that we have within CPS and kind of get us kicked off in that way. But I do want to thank Tracy for her efforts and all the time that she spends. She is a go-getter, and we certainly appreciate everything that she is doing. Our vision for CPS is really kind of laid out there right in front of you, which is really we want to remove the danger and not the child. We see that when families are asking for assistance, it's really a strength, and we don't really see that as a weakness. Family connections should be strengthened and preserved. That is something that really Janae and I have lived by for quite a few years, that she and I have done some work together. And one of the things that we created when we were working with a team out of Minnesota is this tagline of family connections should always be strengthened and preserved. And so we have really embraced that within our CPS division at HHS, and doing what we can to ensure that we are keeping kids and families together. Bad things shouldn't happen to a child in order for them to get services to a family. So we talked, or Janae talked earlier about Director Horak and the early intervention and support services. And we are really looking at how do we do a better job of getting a little bit further upstream so that we can get services to families before something bad happens to them. And then, of course, we always believe in children deserve to have a consistent caregiver. And so if we can do that by keeping kids safely with their families, that is exactly what we want to do. So on the next slide, we want to talk a little bit about what the purpose is of the town halls and how often we're going to be doing them. So what you will see is that we're going to do these town halls every other month. Really, we're looking at having like a consistent time for you to all come and ask questions, provide some suggestions, and really just offer support for our foster parents. So hopefully you'll find this as an opportunity for some information gathering, as well as providing us some things to be looking at and moving forward on. And then we also want to make sure that we're providing you some regular updates on like the Foster Parent Advisory Committee, what's happening within Four Oaks, the Foster Squad, and of course HHS. So hopefully you'll find these things something that you will kind of gravitate towards and join us every other month. There's also a CPS webpage that is a place where you can go, and I believe Claire might be adding that into the chat to kind of join on with a distribution list, submit some ideas for our future town halls, which we would appreciate, because as Janae alluded to in the beginning, you know, we really kind of came up with a place to start, but there might be some things that you're looking forward to hearing about that we just didn't have on our list for tonight, and we can certainly get to it at a future town hall. So, in order to ensure that we are keeping this meeting and this town hall very productive, we want to make sure that we are clear about some of the things that we're not going to cover in town halls. We will not be covering anything that is case specific information. We need to be sure that we're paying attention to confidentiality. So we don't want to really get into those things. And we certainly don't want to get into complaints, because there really is a good process in place already to make sure that we are fielding those complaints. So starting out with that, we always want to make sure that we are doing communication at our level of our social worker case managers. And if there's something that's going on there that we can't get some things resolved and we need to have a up-level conversation, we can certainly go straight to a supervisor. Our SWAs and then our SAMs are very willing to step in and help to make sure that we're getting some things clarified if there is. But there's also a form that can be filled out that is through the website in case there's something that you want to use that form for rather than going through some of that process. But we do encourage you to talk with those local folks first, because they're going to have the most up-to-date information on what's happening in the cases that they're working. Go ahead and move to the next slide, please, Claire. Awesome, thank you. So placement options. I wanted to have an opportunity to talk through what happens when a child comes into the care of HHS and how that looks in regard to our placement options. As you can see in the small circle at the bottom, we really try to start by keeping our kids safely with the parents anytime we can possibly do that. That is always going to be our first goal, is to keep our kids with their parents if we can all do so. And sometimes that means that we do some planning around how do we maintain the safety of the child in that home, which might include having someone move in with the parents, for example, in order to keep a kid safely at home. So we really strive to do our best to make sure that kids stay with their natural supports, helps to reduce the trauma that they experience as well, and keeping them with someone that they know opposed to going into a stranger home helps to do that as well. We always look also, then next step would be at extended family members or those who have some blood relation to a child that already have some kind of a stable connection. And so that's our next step in trying to make a connection for a youth if they cannot stay in their parental home. And then we'll look to, like, if there's someone that's like what we call a fictive kin or not related to them, but it has a connection to them, we want to move in that direction next before moving into a licensed foster home. And then, of course, the last case resort is looking at residential care. So we don't want to place a youth in residential services if we don't have to, because that certainly deepens the level of trauma that youth experiences. Next slide. And okay, our child placement data. This is actually pretty exciting. This is a good comparison of fiscal year 23 in the second quarter, as well as to fiscal year 24 in the second quarter. And it really shows you where we have our youth placed. Iowa is about 50% of our kids that are in care are actually placed with relatives or fictive kin. So I have a question for all of you. If you want to take a guess in the chat, what do you think is the national average for kids placed in relative or fictive kin? Again, Iowa's at 50%. So go ahead and put in a guess of what you think it is for the nation. I'll give you an opportunity to do that. Claire, give me a heads up when we've got a few of them in there, please. I see a 30%, 62, 35, 45, 25. Those are all really good guesses. And I don't recall the name that I saw pop up that said 35%, but whoever said 35%, you are the winner of the prize for the evening, but there's really no prize. It is 35% nationally that kids are placed with relatives and fictive kin. And so in the state of Iowa, we are outdoing what the rest of the nation is doing in regard to placing kids with their family. And it's something that we all really need to be proud of. Okay, this slide talks about Iowa's children in foster care by year. So if you can kind of take a look at that, you will see from fiscal year 12 to fiscal year 23, you'll notice that we have had a significant reduction in the number of kids in care. As a matter of fact, it's been over 35% reduction of kids placed in care. And that is due to a number of things, but in particular, you know, we have spent a lot of time really looking at how we are doing our work and connecting our kids and families together. And so we have really tried to reach out to families kind of in a way that maybe we haven't always done in the past. And so that decline in the kids placed in foster care is something that I know those of us here at HHS in particular are very proud of and have worked really hard at making that happen. I remember years even prior to that, and it certainly didn't look that good. So this is really great work, moving kids and keeping kids with their family. The next slide shows our fostering in Iowa. Yeah, fostering in Iowa slide. So what you will see here is kind of where we're at today, at least at a kind of a snapshot with the number of youth that we have in foster care that are ages 13 to 18. While I go into this, I want to first say thank you to those of you who are on here that are foster parents, because quite frankly, as much as we work really hard to ensure that we have kids and families placed together, we certainly can't do the work that we do without all of you and your help in this system that we all really work in. And so thank you for your efforts. I want to share with you a little bit, like I said, about kind of where we're at today. So you'll see that 33% of the youth are in foster care are between the ages of 13 and 18 years old. And that was some data that we grabbed from fiscal year 24 in our second quarter. So right around February is when we grabbed this data. This is these kids, unfortunately, there's a high likelihood that they will actually age out of the foster care system. There's a significant opportunity right now to do some supporting of our older youth. So many people like to foster youth that are younger, and we love that, and it's great, and we really appreciate that. But we also have many older children that are in shelter waiting for someone to say yes to them. And so we're always looking for people who are willing to, you know, reach their arms out and say yes to some of those older youth that are in our shelters and residential facilities. On paper, all or almost all of our kids who sit in shelter today might look like they're pretty troubled kids. And the things we fail to capture on paper sometimes are their hearts, their talents, and really kind of their desire to just be a part of a family. And it's really hard to put on paper what that looks like, but it's something that takes some time in engaging with the youth to know exactly what they're really about. And again, they're not all what's on paper. And sometimes we have a little bit too much focus on that, and we need to do our due diligence in ensuring that we're making connections to those youth. Again, these youth are more than just their past and more than their trauma. And we're working with Four Oaks to really try and meet all of the youth that are in shelter and in residential care. So at the bottom of this is the Real Hope Project, and there's a link, as you can see, and we're going to watch this Real Hope Project video so that you can see, from a youth view, what it's like for them and who they are and what they're all about.
I grew up, I want to be a vet. The animals that I like best are all animals except for spiders. They're creepy. My first favorite animal is a wolf. Yeah, cats are my second favorite animal. Well, my favorite book series is called Warrior Cats by Aaron Hunter. What I like about Warrior Cats is just a lot of cats. What is unique about me is I saved multiple animals in my lifetime. Another activity I like to do is breaking open rocks. I find a lot of geodes and I throw them on the ground to break them open. The coolest geode I probably found, it was pink, purple, and blue. It was weird. Scratch is a website where you can create things that are on your mind. Basically, a coding website. The game I like to play on Scratch, it's called Kit to Leader. It's an amazing game where you can be a leader. I consider myself as an artist. I'm not saying I'm a professional writer, but I write a lot. I would describe myself as artistic, creative, and unique. What I like to do when I hang out with friends is write and talk. What makes them good friends is they're loyal. Other people describe me as scrappy, passionate, and loyal. My perfect day will most likely be reading, drawing, and writing. I already am writing a series. The things I like to draw is animals and people. The quality of friends I like to have is most likely courageous and loyal. I just go by Kai nowadays. I'm 5,000 years old. My name is Kai, I'm 15, and this is my reel. I'm sorry.
Oh, that connection to Kai and her doing that every time I've seen it, it just brings tears to my eyes. It is a really cool video. The connection that we've made to the Real Hope Project is really cool. I'm just thrilled about it, and I think that that is just one way to really get out how great these youth are, and try to find a way to get people to say yes to them. Because as you can tell, Kai is amazing, and she is very self-aware, and what I would say is probably, I bet you she's one of the biggest helpers around. So I get teary-eyed when I see that. I never shy away from seeing that video because boy, it hits me in the heart. So thank you, Claire, for playing that real quick. Director Garcia, is there anything that you want to add to that part? Because I know that those kinds of things hit you hard too. So
They sure do, Lori. Thanks for giving me a moment here. I think I'm just really, really thankful to our partners over at Real Hope. They came to us. They're working in Minnesota, and they've brought to this just incredible platform. And it took us a little bit of time to figure out the nuances in partnering with them. And now we are truly on a roll. I think we have like 20 youth in the hopper to be filmed. They're a faith-based organization. They're working really deeply too with our strong network of foster and adoptive parents through the church network in Iowa, which is also an amazing space for us to highlight these reels. But yeah, we are so happy to be working with them. And it's so awesome because each one of you, I know, already knows, right? That like what we see on paper versus being able to actually hear someone's own story and connect and see their strengths is just remarkable. And yeah, it's just exciting. Thank you, Lori.
yeah, thank you. Okay, I think I'm handing off this next section back to Tracy. She's going to talk about bridge meetings.
Yeah, and I echo what you guys say too. I know that dab is coming at the end of that video every time I see it, but it makes me smile every time when she does her dab at the end. So I have the pleasure to talk to you guys about bridge meetings. If you're not familiar with them, it's a newer initiative in Iowa, and it's a really cool thing that's happening, and we want to update you and let you know how they're working. So a bridge meeting is a face-to-face meeting with the foster parent and the biological parent within 5 days of the child being placed in the foster home. It's an in-person meeting that's hosted by their HHS worker. And the goal of these meetings is to just create a positive relationship from the get-go between the parents, between the biological parents and then the temporary caregiver. It humanizes each other. So when you're sitting across the table from somebody and looking in their eyes, you can, give a little bit of grace of what both parties are bringing to the table. It's a great opportunity for the foster parent to learn about the child from the biological family And then for the biological family to learn a little bit about the foster family, you know, if they have pets in the home, if the other kids that are in their home, and just to get a better picture of where their kid is living for this temporary time. It's also just a great way to help increase communication, find a communication means that works for both parties. You know, do you want to communicate through Facebook, or are you okay with texting each other or calling each other? But just to get all of those things ironed out with a third party there so that everybody can start off on a pretty positive positive foot. So to help with the communication going forward. These started, they were piloted in a few counties and have now expanded, and it's rolled out statewide. So when a child does come to your home, you should be signing up for these bridge meetings will happen with your HHS worker. So we're excited these are going out. We've had great, some great feedback on what the foster parents think about that. Looks like Erin has a question.
I do. I'm so sorry. I just wanted to get more information about that. I think that is an awesome, awesome idea. And would really help parents. And that sounds awesome. So is that something that the removal worker or the CPAW puts in and says, do you want to do this? Is it supposed to be offered immediately by the ongoing worker? What does that look like realistically on implementing it?
Yeah, so if somebody from HHS wants to step in here, but the foster parent and the biological parent are having comfort calls now within 24 hours of the child going to the foster home, with the HHS worker involved in that call. And then the meetings are set up from that call to get something scheduled within 5 days. And then the meetings are taking place typically at an HHS office.
And if I were to find out that those were not happening, because I do think that's a really, really awesome idea, who would I contact about that?
Lori, you're off mute. I'll let you answer that one.
Did a good job. Yeah, these are really great. If you're finding out that that is not happening, by all means, you can certainly reach out to that worker. If you feel like you need to go above there, please reach out to their supervisor. This is something that we really do need to be pushing forward. We've had some really great results. You'll see as the slide is up here, some of the feedback that we've gotten, and it really does give an opportunity for the parents and temporary caregivers to really have a conversation around, like, what is your youth like? Like, what time do they go to bed? Do they have a special blanket? Like, there's really important things that get discussed in those bridge meetings that we certainly don't want to be missing. So by all means, if you are finding out they are not happening, please reach out to the worker or the worker supervisor and see that we're getting those moving, because they need to happen.
And I want to go back to what you mentioned, a comfort call. Can you explain that to me? Because I have yet to hear about that either. And so I'm going to make sure that that's all happening.
Yeah, Tracy, you want to take that again? Or do you want me to?
Yeah, why don't you go ahead and.
Okay. Yeah, so when there's a placement of a youth, there needs to be a comfort call that happens within 24 hours. And that comfort call really is to kind of just get into a conversation right away so that the caregiver knows, like, what do I need to know now? Like, what do I need to know about bedtime? What do I need to know about medications? Who do I need to, should I be asking mom or dad about what does their bedtime routine look like? What does their snack look like? Those kinds of real immediate things can be discussed in that comfort call. And again, it's really just trying to create a situation where the biological parent feels some level of comfort, because I'm sure if we all took a step back and thought about what it would be like for our own kid to go into care, I would not want to wait 5 days to know who my kid is with and what that person is like. I would want to know right away. And quite frankly, it would be devastating for me. So we're trying to just get our parents to feel a little bit more comfortable and more connected, and also get our foster parents more connected to the parents right out of the gate so that they can build a connection in order to work together to get the youth returned back to the home.
Last question, I promise. Sorry. Is that comfort call between the department, bio parents, and foster? And
Yes.
Okay, thank you.
And
Yeah, you got
Erin, it's Kelly. I don't know if you can see me since you might be on the phone, but
I'm driving. Sorry, you guys.
Yeah, no, it's totally fine. Thank you for calling in. But I know Jana's on. And since you are working in the Des Moines service area, I'm just going to ask Jana. I was going to try to chat her this, but I think our chat is disabled to be direct. But Jana, if you can just check on the cases that Erin's on, to do a little double check there, and then we can reach out to you proactively. But yeah, it is absolutely, like, we piloted this some time ago. It should be happening. It should be happening. If it's not happening, we do need to know, and Lori needs to know, right? Because the support around the training, anytime we're rolling out anything new, we've got to double check. We've got a lot of workers out there, right? And folks are trying to do their very best, but this is a huge mechanism. We got great feedback, to Tracy's point, when we were piloting, and this came directly from foster parents as an idea. So that's just my plug to say, like, we need to hear directly from you, because this is a team sport, and something that you can see just by these quotes and by Tracy's reaction, exactly how helpful it is to all parties involved, our workers included.
Director Garcia, too, I would also just add that this might just be something that people haven't heard of yet. It doesn't mean that they're not happening, and that it happens
Absolutely.
so early on in the case that typically a GAL is not involved yet. And so they're likely to have already happened before this case then gets to court after the removal has occurred. So I would say, Erin, if you have any questions or concerns, just reach out to my team, myself, and we'll be happy to walk you through any case you have questions on.
I do know some are happening, so I apologize if I made it seem that way, but I agree. Absolutely. Thank you.
That's perfect, Jana. Thank you so much.
Yeah, and so for those of you foster parents who haven't been a part of this too, just so you know, when these meetings happen, it's scripted. There's a process in place that the HHS worker will follow, and there's even questions for you that you can use to help ask the biological parent questions, just to help stimulate some conversation. And we can't imagine what it's like to have a child removed from our home and staying with a stranger. So anything we can do to help that biological parent feel more comfortable and know that they're in a safe space, and that you're there to help take care of that child while they get better, will just be better for the child. There's no question about it, that if the biological parent isn't worried that there's a adversarial relationship between the foster parent and themselves, they're going to be able to focus on themselves. So these meetings are exciting, and hopefully we'll get to report back as we continue to do these town halls about how they're continuing to do great things. I was going to read through these, but I bet you all have had a chance to read through the quotes up on this slide. But the one thing that I think when I look at this, preventing a medical emergency, there are some serious things that these biological parents can tell the foster parents to make sure that the child's being cared for as well as possible. So it's an awesome thing, and I'm thankful for the department for getting these rolled out and quickly. That pilot project started in the end of 23, or the beginning of 23, I think, end of 2022, beginning of 2023, and it's already statewide. So kudos to our HHS team for making that happen. And I think I get to throw it back to Lori again now.
You do. We're playing catch tonight, Trace. Yeah, thank you for that. Okay, some legislative changes that are coming your way, in case you had not seen or heard. We did get a 5% increase in payment for licensed foster parents. That will start after July 1st of this year. We also got a 5% increase in payment for adoption subsidies for adoptions that are finalized after July 1st as well. So moving in the right direction. I can tell you that we would have hoped for more, but we are certainly very grateful for the legislature for doing what they have done for us. So looking forward to those coming your way, and those will be done automatically. So sooner than later, we're getting there, you guys. But like I said, we really did want it and hoped for a little bit more, but never going to complain when we get something from our legislators, and we appreciate them very much. So yeah, so you'll be seeing that after July 1st. I'm throwing the ball back to you, Tracy.
All right. And just a PS to that, if there's any foster families on here who are connected with the foster squad, we sent out a survey to get your input on the stipend, and for you to give us some real practical data on what you were spending that money on and how much money you were spending beyond your stipend. And we had a lot of foster parents respond to that, which gave us great data that we could put together and take to the legislators and show them exactly how it was hitting your pocketbooks. And I'm super thankful to all of you who gave us that data. And filled out the survey. And if you aren't connected with us, I would encourage you to go to our website and get connected, because we do this regularly. We'll send out surveys to get your feedback on things so that we can represent you to the legislators and to Director Garcia and her team too. So just want to throw that out there. But then I have another great story to share with you guys. So these lavender bunnies are from a company in Michigan that is called, let me see, I've got it here. The name of the company is the Lavender Life Company, and they're stuffed animals that are scented with lavender. The company will donate a bunny to a child in foster care for everyone that is purchased. And there's a girl in Des Moines, a high school student, who decided that she wanted to make sure that kiddos in Iowa who were in foster care got a lavender bunny. So she took it upon herself. She had to pay for the shipping to get 3,000 bunnies here. And then she had to get a crew of her friends together to pack them. I think that first slide showed the bunny with a bag, and they got packed into these little bags and then boxed up. And I heard there were boxes and boxes and boxes of these bunnies that made the whole HHS office smell delightful. But then they got sent out to kids throughout the state. And this picture is several leaders from different organizations throughout Iowa who were able to hand them out to kids that they're caring for, either at the shelter or other different locations throughout the state. So we just wanted to share with you, there are some great people in the state doing really cool things to help support the kiddos and to support the foster families caring for them. And so this was a cool story of a high school student who just really stepped up to do something cool for kids.
Yeah, she accomplished a lot more in high school, I think, than I did, even through graduate school. She is she's very motivated, and her heart is in a really great spot. And I hope that those are getting out. So thanks for that, Tracy. Last little bit, this is the easy piece of the night. I hope Kai is on, because I'm really just handing this off to Kai to do some introductions and I think talk about the Foster Parent Advisory Committee, and maybe there's some folks on, I'm not certain. So Kai, are you out there?
I am. I have to apologize because I'm in Arizona at a conference, and periodically parades appear to be going down the street in front of the hotel for whatever reason. So if you suddenly lose me, that's why. So hi everybody, my name is Kai McGann with Four Oaks, and I'm the statewide director of our RTS program, which is our foster care and adoption services. And I know multiple colleagues of mine have joined tonight. I think we have the program directors from all of our service areas are on tonight, as well as several of our managers who are in charge of training and some other services that we provide. Thanks for everything that's been presented so far. I was really pleased to work closely with HHS to help get the word out to some foster families about the need and the desire to put together a resource family advisory committee. And so that has been formed and has been up and going with representation from around the state. They've self-identified leadership. They are meeting independently. Myself and some other stakeholders and HHS foster care program manager Nancy Swanson will jump on, as well as the adoption manager Laura Lease, and just kind of give some brief input and updates. And then the advisory council will continue on with their efforts. And I believe that we were expecting that some advisory committee folks would be on tonight, and I can't see everybody on my screen. So I'm just going to actually see if there is anybody from the Resource Family Advisory Committee. Could you unmute and kind of speak up and introduce yourself if you don't mind? Okay, we may not have successfully captured one of them tonight. Nancy, do you want to talk about the advisory committee at all and their kind of leadership cohort?
Sure. What I would say is it's been a really exciting endeavor to pull these families together and get their perspectives on the experiences that they've gone through, their ideas for other foster parents and things that they feel that HHS should be focusing on. They've been helpful in reviewing initiatives that we are working on, bill reviews that we were working on, getting their feedback. We've also had other program managers in other areas, not just the foster care area, have them look at things like for psychotropic meds and different things to get perspective on things that impact them in their own household setting. I know that in future town halls, we were hopefully going to have them be a part of maybe leading some of those meetings to talk about some of the things that they feel would be important to focus on for them, and to support possibly Foster Squad and to collaborate on some of those things. So those are exciting things coming forward. I'm not sure if anyone has any questions on that or if there are things that I can answer. I can definitely put their email in the chat so that if anybody wants to reach out to them directly, has ideas or questions for the advisory committee as far as what they're working on, that way you can reach out to them directly.
Thanks, Nancy. I know one kind of common thing that we've been hearing from foster families a lot lately, and the advisory committee has heard about and has been working on, as well as Foster Squad, is concerns about availability of dental care or dental providers who will accept Medicaid without foster families having to drive extensive amounts of time to find a provider. So that's a topic that I believe that they are tackling, and I'm sure that they will have updates available in the future. Thanks for giving a few moments to let us kind of jump in and speak out a little bit. And I would just say that from a Four Oaks perspective, and I know our HHS partners, Foster Squad, the Resource Family Advisory Committee, whatever, kind of a no wrong door. So if you are in this meeting tonight and you have a question or a concern, I hope you feel comfortable reaching out to any one of us, and we will find a way to get you to the right place to get you answers that you need. Thanks, everybody.
Thanks, Kai. Really appreciate you taking the time, and I hope you're having some fun in Arizona, even though you're there for a conference. The next town hall is scheduled for Tuesday, July 2nd. So you guys can anticipate getting some information coming your way about the next one. By all means, if you have agenda items, you can certainly send them, as Kai said, really kind of any direction you want, but they're, I think Claire may have put something in the chat about that. Otherwise, we want to go ahead and roll to questions and see what questions are out there in regard to anything that we talked about tonight. And we'll open up the floor.
You did such a good job, Lori. None of them have questions.
I think Tracy did a good job.
These are recorded and available on the web, right?
Correct.
Yeah.
Any questions out there? Otherwise, we can give you back 15 minutes that we had set aside for tonight.
I don't have a question per se, but I do want to take the opportunity for those folks who advocated really fiercely at the legislative level to get an increase in the daily reimbursement rate for foster parents. I thank you deeply, representing any foster parents who are not in this meeting tonight. Thank you guys for all of your effort and work. I know there was a lot going on behind the scenes. And so I'm glad that there was a positive result at the end of the legislative session. So thank you very much.
Thanks, Kai. Anything else before we hang up for the evening? Okay, if you do have something, by all means, feel free to reach out. You can certainly do that. And we seriously thank you for your time tonight. Thank you for joining us. And we look forward to having more conversations like this. Tracy, thank you so much for jumping into this right out of the gates, because this is our first one and you're like, I'm in. So thank you for that. I appreciate appreciate that.
Yeah, thanks for inviting me. I was honored to be a part of it. This was great.
Awesome. All right. Thank you. Have a great night.